What is homeopathy? What does a homeopathic doctor like myself do? What would you expect to go through when you visit a homeopathic doctor? Well, the first duty of a homeopathic physician or doctor is to do everything that a good, ordinary, orthodox or conventional doctor would do. He should take a full history, which I always do, as well as doing an examination if necessary. But in addition to this, a homeopathic doctor, like myself, will ask you a lot of questions about yourself, about your problem as well, more detail about your problem than an ordinary GP. A homeopathic doctor would ask you, say for example you had a pain in your hip, he would ask you, when does the pain occur? Is it in the morning? Is it in the evening? What makes the pain better? What makes it worse? Is it better in cold weather, in warm weather? Do thunderstorms affect it? Does what you eat affect it? Do your emotions affect it? Tremendous detail about the problem itself. But not only that, I would go on to ask you questions about yourself. What sort of foods do you like? Are you a hot or cold person? What side do you sleep on when you sleep at night? Do you have recurrent dreams? What's your personality like? Are you an angry person? Do you lose your temper? Are you a calm person? Do you keep emotions inside or do you express emotions? Do you have any fears? Do you have any phobias? What are your likes and dislikes in life? And many, many more. Now, why would I, a homeopathic doctor, ask all these questions of you? The reason is I wanted to understand how your whole body functions, not only the details about your illness or disease. I want to understand how the whole of you works, including a lot of detail about the illness. Why do I need to know this? Because my aim, first of all, as I've said, I need to exclude orthodox diagnoses and institute treatments for those if necessary. For example, if a person with appendicitis comes in, they must have surgery. If child might have meningitis, I need to diagnose that meningitis and treat appropriately with the diagnostic skills and antibiotics that are required. However, if I've decided that the situation is not critical and there's no risk of permanent damage, I can first try a homeopathic medicine. In order to prescribe this medicine, I need to understand the whole of you, how you tick, as it were. So, my goal of giving you this medicine, and what I'd like this medicine to do for you, is to stimulate your body's natural healing ability. In other words, I want to push your body to heal itself if it can. If I've assessed that your body can't heal itself and you need surgery or antibiotics, then I must give you those. But if I think, you know what, this body could probably overcome this illness, it could do something about this illness, it could get better, but it isn't doing so. Can we give it a push? Now you can't push or stimulate or catalyze or provoke an illness to heal itself. But you can perhaps provoke or stimulate or catalyze the whole human organism to heal the disease or dis-ease within its gestalt, within its whole. And this is the goal of the homeopathic remedy. The medicine needs to suit not only the illness or disease, it needs to suit the individual in whom the illness or disease is occurring. Then we give this medicine very, very low doses and hope that it stimulates the body to heal itself. Now, how do we match a medicine to a person who has an illness or a disease? That's an important question. Homeopathic medicines in their gross state, for example, if we use a plant like belladonna or aconite, in its gross state, undiluted state, it would produce certain symptoms in people. And these symptoms have been recorded both in toxicology, which means the study of poisonous reactions in people, and by giving people medium doses of certain medicines and observing what symptoms develop in those people, which we call provers. So these are both methods of discovering what effects certain medicines, poisons, plants, herbs have on people. Now, homeopathically, what we do is we give the medicine in a very, very dilute or potentized form, okay, which is produced in a very special way. We give it in this dilute form to people who are having the symptoms that that medicine would have caused them to have in a gross form. So in other words, we are treating like with like. We are giving a medicine in a very low dose to somebody who has symptoms that same medicine could have produced in its normal form. And for some reason, and there are various explanations for this, that when you give it in a very low dose, instead of poisoning, instead of causing symptoms in the body, it actually stimulates the body to go and fix the cause, the very cause of those symptoms. It is what my teacher, Dr. Eric Lederman, the late Dr. Eric Lederman, philosopher, homeopath, acupuncturist, psychiatrist, he said that homeopathy is an example of an holistic stimulus, a stimulus to the whole person, to stimulate the body, to balance itself, and by balancing itself, also to heal the illness within itself. This is the goal of prescribing a homeopathic remedy. You would experience it by talking to a doctor in a natural way about all your symptoms, first in the normal orthodox way, and then in much more detail, and then talking a lot about yourself so that I can understand how you tick and select a medicine that not only suits your disease, but suits you as well.